I was so excited that I actually showed my mom my hands. Like, they had cleared up a bit already.
Indication and usage. OPZELURA is a prescription medicine used on the skin, topical, for the short-term and non-continuous chronic treatment of mild to moderate eczema, atopic dermatitis, in non-immunocompromised adults and children 2 years of age and older, whose disease is not well controlled with topical prescription therapies, or when those therapies are not recommended. Important safety information. Do not start OPZELURA if you have an infection, as it may lower your ability to fight it. Tell your doctor if you have or had an infection, TB, hepatitis B or C, blood clots in legs or lungs, heart attack, stroke, cancer, high cholesterol, smoke, or are pregnant. May cause serious lung infections, certain cancers, immune system problems, blood clots, and low blood cell counts. Major cardiovascular events or death occurred in those 50+ taking oral JAK inhibitors.
My name is Cameron. I'm a 15-year-old freshman from Cincinnati, Ohio. I've struggled with eczema since infancy, for as long as I can remember.
When he was a baby, watching him scratch, even as a young infant, at his face, and could tell that he was uncomfortable.
The areas I experienced it most were here on my hands and the inside of my elbows right here, as well as my neck, my face, and my eyelids. I experienced a lot of inflammation, a lot of itchiness, a lot of dry, cracked skin, discoloration, and just a lot of discomfort in general. I always liked to play sports and just be active. I noticed after I would exercise or play soccer or do anything like that, my skin would get really inflamed and red. I stopped swimming because it just took a toll on me. It made my skin dry out, which made my symptoms worse.
The eczema flare-ups just got to the point where he couldn't stand the water touching him. Watching him go through the eczema flare-ups and the itching, it makes me feel helpless because I know he's suffering and there's nothing I can do to help him.
We tried almost everything we could find. A lot of over-the-counter medications, as well as prescriptions, different steroids and lotions, just trying to find something that would bring me relief.
And even when we were given a prescription, it can only be used on certain parts of the body. I was looking for relief from the symptoms, something that would help reduce the itching, reduce the redness.
I discovered OPZELURA after going to the dermatologist for a different treatment. I noticed early on a reduction in itching.
He didn't remember waking up overnight because of the itching. So I think that was the first indication that we might be onto something here.
I also noticed a reduction in the physical appearance, less red and inflammation on my skin. I liked that it was a cream and I couldn't feel it on my skin after applying it.
I think he had no problem applying it because he saw actual results. And in seeing the actual results, he wanted that to continue.
I could also see the results of what it was doing to my skin. It no longer looks discolored or red or inflamed. It worked for me.
I felt hopeful too. I felt happy to see how excited he was that this already appeared to be working and relieving his symptoms.
I would recommend it to someone with mild to moderate eczema.
Talk to your dermatologist, your child's dermatologist, about OPZELURA. It definitely brought Cameron the relief we had been seeking.
If I could use one word to describe OPZELURA, I would say relief.
Absolutely.
After battling and struggling with symptoms for so long, I'm finally able to feel relieved.
Indication and usage. OPZELURA is a prescription medicine used on the skin, topical, for the short-term and non-continuous chronic treatment of mild to moderate eczema, atopic dermatitis, in non-immunocompromised adults and children 2 years of age and older, whose disease is not well controlled with topical prescription therapies, or when those therapies are not recommended. The use of OPZELURA, along with therapeutic biologics, other JAK inhibitors, or strong immunosuppressants such as azathioprine or cyclosporine is not recommended. It is not known if OPZELURA is safe and effective in children less than 2 years of age with atopic dermatitis. Important safety information. OPZELURA is for use on the skin only. Do not use OPZELURA in your eyes, mouth, or vagina. OPZELURA may cause serious side effects, including serious infections. OPZELURA contains ruxolitinib. Ruxolitinib belongs to a class of medicines called Janus kinase, JAK inhibitors. JAK inhibitors are medicines that affect your immune system. JAK inhibitors can lower the ability of your immune system to fight infections. Some people have had serious infections while taking JAK inhibitors by mouth, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that can spread throughout the body. Some people have been hospitalized or died from these infections. Some people have had serious infections of their lungs while taking OPZELURA. Your healthcare provider should watch you closely for signs and symptoms of TB during treatment with OPZELURA. OPZELURA should not be used in people with an active, serious infection, including localized infections. You should not start using OPZELURA if you have any kind of infection, unless your healthcare provider tells you it is okay. You may be at a higher risk of developing shingles, herpes zoster, while using OPZELURA. Increased risk of death due to any reason, all causes. Increased risk of death has happened in people 50 years of age and older who have at least one heart disease, cardiovascular, risk factor, and are taking a medicine in the class of medicines called JAK inhibitors by mouth. Cancer and immune system problems. OPZELURA may increase your risk of certain cancers by changing the way your immune system works. Lymphoma and other cancers have happened in people taking a medicine in the class of medicines called JAK inhibitors by mouth. People taking JAK inhibitors by mouth have a higher risk of certain cancers, including lymphoma and lung cancer, especially if they are a current or past smoker. Some people have had skin cancers while using OPZELURA. Your healthcare provider will regularly check your skin during your treatment with OPZELURA. Limit the amount of time you spend in the sunlight. Wear protective clothing when you are in the sun, and use a broad-spectrum sunscreen. Increased risk of major cardiovascular events. Increased risk of major cardiovascular events such as heart attack, stroke, or death have happened in people 50 years of age and older who have at least one heart disease cardiovascular risk factor and taking a medicine in the class of medicines called JAK inhibitors by mouth, especially in current or past smokers. Blood clots. Blood clots in the veins of your legs, deep vein thrombosis, DVT, or lungs, pulmonary embolism, PE, can happen in some people taking OPZELURA. This may be life-threatening. Blood clots in the vein of the legs, deep vein thrombosis, DVT, and lungs, pulmonary embolism, PE, have happened more often in people who are 50 years of age and older and with at least one heart disease cardiovascular risk factor taking a medicine in the class of medicines called JAK inhibitors by mouth. Low blood cell counts. OPZELURA may cause low platelet counts, thrombocytopenia, low red blood cell counts, anemia, low white blood cell counts, neutropenia, lymphopenia, leukopenia. Your healthcare provider may do a blood test to check your blood cell counts during your treatment with OPZELURA and may stop your treatment if signs or symptoms of low blood cell counts happen. Cholesterol increases. Cholesterol increase has happened in people when ruxolitinib is taken by mouth. Tell your healthcare provider if you have high cholesterol or triglycerides. Before starting OPZELURA, tell your healthcare provider if you have an infection, are being treated for one, or have had an infection that does not go away or keeps coming back. Have diabetes, chronic lung disease, HIV, or a weak immune system. Have TB or have been in close contact with someone with TB. Have had shingles, herpes zoster. Have or have had hepatitis B or C. Have lived in, or have traveled to certain parts of the country, such as the Ohio and Mississippi River valleys and the Southwest, where there is an increased chance for getting certain kinds of fungal infections. These infections may happen or become more severe if you use OPZELURA. Ask your healthcare provider if you do not know if you have lived in an area where these infections are common. Think you have an infection or have symptoms of an infection such as fever, sweating or chills, muscle aches, cough or shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinating more often than usual, feeling very tired, have ever had any type of cancer or are a current or past smoker, have had a heart attack, other heart problems, or a stroke, have had blood clots in the veins of your legs or lungs in the past, have or have had low white or red blood cell counts, are pregnant or plan to become pregnant. It is not known if OPZELURA will harm your unborn baby. There is a pregnancy exposure registry for individuals who use OPZELURA during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. If you become exposed to OPZELURA during pregnancy, You and your healthcare provider should report exposure to Insight Corporation at 1-855-463-3463 or www.opzelura.pregnancy.insight.com. Are breastfeeding or plan to breastfeed? It is not known if Opzelura passes into your breast milk. Do not breastfeed during treatment with Opzelura and for about 4 weeks after the last dose. After starting Opzelura, call your healthcare provider right away if you have any symptoms of an infection. Opzelura can make you more likely to get infections or make worse any infections that you have. Get emergency help right away if you have any symptoms of a heart attack, blood clot, or stroke while using Opzelura, including discomfort in the center of your chest that lasts for more than a few minutes or that goes away and comes back, severe tightness, pain, pressure, or heaviness in your chest, throat, neck, or jaw, pain or discomfort in your arms, back, neck, jaw, or stomach, shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea or vomiting, feeling lightheaded, weakness in one part or on one side of your body, slurred speech, swelling, pain, or tenderness in one or both legs. Tell your healthcare provider right away if you develop or have worsening of any symptoms of low blood cell counts, such as unusual bleeding, bruising, tiredness, shortness of breath, or fever. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Opzelura in people treated for atopic dermatitis include common cold, nasopharyngitis, diarrhea, bronchitis, ear infection, increase in a type of white blood cell eosinophil count, or decrease in a type of white blood cell neutropenia count, hives, inflamed hair pores, folliculitis, swelling of the tonsils, tonsillitis, and runny nose, rhinorrhea, upper respiratory tract infection, COVID-19, fever and pain, irritation, discomfort, or itching at the application site. These are not all of the possible side effects of Opzelura. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Insight Corporation at 1-855-463-3463. Please see the full prescribing information, including boxed warning and medication guide at opzelura.com.